Hi, I'm Clay. I'm your nurse practitioner today. Can you tell me your name and date of birth?
Ashley Pierce, 32696.
Okay, I'm going to do some hand hygiene. So we're going to do your head to toe assessment today. Do you have any concerns or issues I need to know about? Okay. So first, I'm going to inspect your head, hair, and scalp. I'm just looking for any excessive drying, lesions, scratches, lice. Okay, everything looks good. Next, I'm going to check your frontal and maxillary sinuses. Any pressure or pain? Okay, next I'm going to check your lymph nodes, your pre-auricular, post-auricular, occipital, anterior cervical, posterior cervical, supraclavicular, tonsillar, submandibular, submental. Okay. Next, we're going to check your thyroid. Go ahead and swallow for me. Okay. Next, we're going to check your visual acuity. So just cover one eye for me. And I'm going to give you a number. You're just going to repeat it for me when you see it.
1, 1, 1, 1.
Okay, other side, please.
2, 2, 2, 2.
Okay. Next, we're doing convergence, so just follow my finger, please. Okay. Next, we're going to check your cranial nerves 3, 4, and 6. Just keep your head still and follow my finger. Okay. Next, we're going to check your cranial nerve 7. I'm going to place my hands on your eyelids, just force them closed. Go ahead, open them for a moment. Now force them closed. Okay, good. Now show me your teeth. Okay, we're going to check your pupil response. Now I'm going to inspect your eyelids, cornea, and conjunctiva. Okay. Next, I'm going to check your hearing. Okay, first I'm going to inspect your outer external ear. Just looking for any drainage or lesions of any sort, any signs of infection. They look good. So place one hand over one ear, and I want you to repeat after me. Football, baseball,
Baseball,
32.
32.
Okay, other side.
Baseball, football, 32.
Okay. So next we're going to do the Weber test. All right, I'm going to strike this. This tuning fork is going to vibrate. I'm going to place it on your head. You should hear it symmetrically. Tell me if you do or if you hear one greater than the other.
Both.
Okay. Next, I'm going to strike it again, and I'll place it on the bone behind your ear. We'll do both sides. Whenever you feel it stop, you tell me stop, and then once you, then I'll place it up to your ear. Once you don't hear it anymore, you say stop again. Okay.
Stop. Stop.
Okay. Next side. Pull your hair back a little bit.
Stop.
Okay. Next, we're going to inspect your nose. I'm just looking for redness or any signs of infection. Next, we're going to inspect your mouth and throat. So we'll be looking at your lips, gums, teeth. I'm also going to be looking at your posterior pharynx. Okay, go ahead and say ah.
Ah.
That's cranial nerve 10. Okay, everything's pink and white, so that's good. Okay, next we're going to check your cranial nerve 12. So stick your tongue out and go side to side. Okay, next is going to be cranial nerve 5. So what I'll have you do is just open your mouth and then bite down, checking your masseter muscles. And now we're going to do sharp and dull sensation. So you'll tell me sharp or dull. Close your eyes on your left cheek, right cheek, or forehead.
Sharp right cheek. Soft or dull right cheek. Sharp left cheek. Left forehead.
Okay, good. Next, we're going to check your cranial nerve 11. I'm going to place my hand on your side. You're going to turn your head that way. Check the strength of your sternocleidomastoid. Okay. And now your shoulders, your trapezius. Shrug, please. Good. That's also your cranial nerve 12. So now I'm going to inspect your thorax and auscultate and percuss your lung fields. Okay. So I'm just going to inspect. I'm just looking for symmetry and just the overall shape of your lungs. Okay. Just breathe normal with your mouth open, please. Okay. I'm going to percuss. And lift your arms for me. Okay. Next, we're going to check your cardiovascular system. So I'm going to have the head of the bed 30 to 45 degrees. Go ahead and lay back. Okay. We're just looking for your venous jugular pulse here. Make sure it's visible. Yeah, we'll check the other side. Okay. Next, I'm going to palpate your cardiac locations here. You have the aortic, pulmonic, tricuspid, mitral, and then this is also the PMI. Yeah, auscultate now, same areas. in a real patient scenario and make sure that I was placing the stethoscope on the skin. Okay, so next we're going to check your carotid arteries here. I'm going to palpate and then auscultate one at a time. I'm just looking for a bruit or a thrill. Okay, next I'm going to auscultate your abdominal aorta. Okay, next I'm going to palpate your pulses, so I do femoral and popliteal. I'm just comparing each side to each other. Now tibial and pedal. I'm also looking for any edema in the legs. Okay, we're going to lay your head back and I'm going to do your abdominal assessment here. Okay, so first we're going to inspect and then auscultate and then percuss and then palpate. Okay, we're going to do each quadrant. Okay, I'm going to palpate. Let me know if you have any pain anywhere. Okay, next we're going to palpate for liver and spleen. Go ahead and take a big deep breath in for me. Okay, you can breathe. And once more, this is the spleen. Okay, I don't feel any enlargement either. Now I'm going to percuss for the liver span. And that's normal. Okay, fix that. Next, I'm going to check for your musculoskeletal system here. So we're, no, you can stay like that for now. I'm going to check range of motion in your hip first. I'm just listening for any crepitus, any pain, swelling, any redness. So do this knee, your ankle. Okay, other side. Okay, knee. Okay, ankle. Let's do your elbows, and shoulders. Shoulder. And just move all your fingers for me. Good. Okay, now we can go ahead and stand up. Okay, so now I'm going to check the alignment of your knees, of your heels, and your feet. Okay, and that looks good. Next, what we'll do, We're going to check your lateral bending. So if you could just lean. And notice that you do have a little bit of curvature. Can you turn around for a second? Do you have scoliosis?
Yes.
Okay. Go ahead and bend once more for me. Yep. To your right and to your left. Good. Next, we're going to check your lumbar flexion and extension. So bend over, touch your toes, and then extend back for me. Good. Any pain? How is it with your scoliosis? Do you have
It's
to?
good. I follow a spine specialist.
Okay.
Yearly, so.
Okay, so next we're going to check your costovertebral angle tenderness. So you can just stay standing. So what I'm going to do is turn you here towards the camera. I'm going to place my hand right over here, and I'm going to give you a little thump. If you have any tenderness, okay, just let me know. Any tenderness? Okay. Okay, so next I'm going to have you do the Romberg test. So what you'll do is just cross your arms over like this, close your eyes, and for 10 seconds you just stand there. I'm just looking for any swaying. Okay, next you stick your hands out, palms up. We're doing the pronator drift test. I'm just watching to make sure that one of your arms doesn't start to drift down. Okay, next we're going to check your gait. So if you could just walk this way for me and yep. And turn around and walk back. Just walk normal this time. And then come back on your toes. Okay, and then back on your heels. And then do heel to toe. Okay. Squeeze both my fingers here. Good. Biceps, pull up. Pull up. There you go. And then triceps, extend down. Okay, good. Go ahead and have a seat right here. Lift your knee up. This knee up. Push out. Push in. Push against me. Pull. Good. Okay. Next, we're going to check your reflexes. We're going to check your biceps, triceps, brachioradialis, and your patellar, Achilles, and Babinski. Okay. I'll do the tricep here. Okay. Here's your patellar. This is your Achilles. And then the Babinski. Okay, sorry. All right, next, I'll have you just follow my, your finger, you're going to touch my finger, and then your nose. Okay, next we're going to check your position sense and vibratory sense. So what I'm going to do is I'm going to take your foot here, and you're going to close your eyes. I'm going to separate your toes from your big toe. I'm going to put your toe up or down. You're going to tell me if it's up or down.
Up. Down. Down.
Okay. Next, I'm going to make a vibration with this, and I'm going to place it on your toe, and you're going to tell me if you can feel it, okay?
Eyes closed.
Mm-hmm.
Yes.
And tell me when it stops.
Stop.
Okay. All right, that concludes the assessment. Thank you.